In Collierville right now, we're getting an update from hospital officials. Let's take a listen in.
This from pre-hospital to this may go on for a while.
Of breaking news that we continue to follow out of Collierville, Tennessee. If you're just joining us, of course, yesterday a mass shooting in Collierville, Tennessee at the Kroger at Byhalia and Poplar. 15 people shot, one person was killed. Collierville police just wrapped up a press conference where they updated us, letting us know more details about those 15 victims, including confirming the identity of the gunman. They also let us know that 10 of the people that were shot were employees and 5 of them were victims. We're getting now an update on those conditions. Let's send it back to the hospital.
But we were able to mobilize all the patients and resources needed in order to take care of this mass casualty situation. I do want to recognize those that were able to facilitate this, and I also want to emphasize that this was a team effort. That's how we roll here at Regional One. It's a team effort. A lot of people throw around terms like team, but it really happened here. From pre-hospital personnel, which obviously their role is critical, our own security, how the area was secured as the patients were coming in. Nursing was phenomenal, as they always are, but especially phenomenal today. The trauma surgeons, of course, being a recovering surgeon, I'm very proud of them. Emergency medicine, respiratory therapy, x-ray techs, registration, admissions, operating rooms, and environmental services. They're all key to the smooth operation of handling such a situation. Right now, I'd like to introduce Dr. Andy Kerwin, who is the Chief of the Division of Trauma and Critical Care at Regional One and University of Tennessee Health Science Center. Dr. Kerwin.
Thank you, Dr. Croce. Thank you for coming today, and it's unfortunate again that we have to talk about these issues. Update on some of the patients. We received a total of 8 patients yesterday in a very short time after the event. One of those patients is deceased and 3 remain in critical condition. 3 required emergency surgery last night after they arrived. I think that the events yesterday and our response were, while the event's terribly unfortunate, the response was incredible. Great teamwork to enact our disaster plan, to mobilize patients that were already in the hospital and in our trauma receiving areas, to free up space so that we could get those patients in and get them assessed, treated, and stabilized. So incredible job by all of the facets of our trauma program. The way that it worked, I think, really highlights the incredible legacy that is here as Regional One, as our Level 1 Trauma Center that serves not only the citizens of Memphis, but the surrounding citizens for about 150 miles around us. Just an incredible team response to get everything organized, get all of our resources pooled together, just like we do on a daily basis, but not to this magnitude. And so I really think it speaks volume and highlights the importance of Regional One as the trauma center for this region. It's really a great event that ran very, very smoothly for us yesterday, and I'm really proud to have been part of that and provide the great care for these patients. I think next I'll have Dr. Peter Fisher, who's our trauma medical director. He's going to come up and talk about the the region's response to what happened yesterday. So thank you.
It's okay with you all. We're going to wait till him to take off for just a second. It's going to be really loud here for a little bit. Good morning. My name is Peter Fisher. I'm the Trauma Medical Director here for the Elvis Presley Trauma Center at Regional One Health. You know, again, just to follow on Dr. Kerwin's and Dr. Crose's comments, we train for these mass surge events. We've been working very hard for the last 5 years on our plan. We haven't drilled it, to be honest, in about a year and a half, secondary to COVID and everything else like that, and it still came together yesterday phenomenally well. That's secondary to the team that stands behind me and stands in this hospital behind us. And, you know, again, it really is just remarkable how well it worked and how well it worked when it needed to work. Also want to stress the regional response. Regional One is here for the most critical patients, but we can't do it without our hospital partners in the region. As noted in the press conference this morning, you don't want to build relationships at the time of disaster. And we've been able to build the relationships over the past year and a half, 2, 3, 4 years. And it was a phenomenal response from everyone in the entire region, from the Methodist University, St. Francis, Baptist, all of which were willing to help and helped tremendously in this situation to make sure that they took patients as well and were ready for patients as well. At this point, I'll be happy to turn it over to questions. I'll let Dr. Krose kind of lead the question and answer area, but anyone behind me right now is available for any questions you may have.
I have a question. Can you give us the gender or age range of the patients you all received?
We received 8 patients. They range. Oh, Siri's answering my question for me. They range the gamut. I can't really be more specific than that. But thanks.
For the last few weeks, I know about a month ago, there was a letter sent out from all the emergency department heads, regional medical centers, when it comes to how the hospitals, when it comes to the service, when it comes to COVID-19. I know you said 20% of your patients here were COVID-related. And we know during that press conference, it was said that there was hospital shortages, and there was a fear that if there was a mass casualty event, there would be a little bit of trouble. Did you run into that? I know you said things moved. Was that a concern?
That's always a concern, quite frankly. I want to echo what Dr. Fisher said about the cooperation amongst all the hospitals. We met long ago when COVID kind of started, and we all work together so that we can keep as many of the resources to this community open as possible, anticipating an influx of patients that would come to all the different hospitals. And the other hospitals have tried to take more of the COVID patients so that we could continue to focus on taking care of the trauma, burn, high-risk OB, and newborn center patients as well. I think it emphasizes cooperation amongst all of our hospital partners. But importantly, it demonstrates the importance of Regional One Health to this community, that we're able, with the help of everyone else, to maintain the services and continue to take care of as many patients as we possibly can, regardless of their malady.
Are you able to speak to the severity of the 3 people that are still in critical condition?
No, I'm sorry.
Let's talk about the midwing response. How many patients do you transport via midwing?
How many? I'll let Dr. Fisher take that.
Hospital Wing actually dispatched 5 helicopters to the scene. Another 3 helicopters from other agencies were also dispatched to the scene. I was actually on one of the helicopters. I was actually by chance staffing one of the helicopters. So 2 helicopters ended up making the scene. No patients were transported by air. All patients were transported by ground, which again shows the amazing pre-hospital response that we had. You know, when we plan, sorry, I can take my mask off. For these mass casualty situations that are shooting related, the key is to get the patient here as quickly as possible. The ground ambulances were there. They did exactly what they were supposed to do, which is grab the patients and move. It was a tremendous response. I think, kind of looking forward through this, as we look at our plan and the regional plan, there's always opportunities for improvement and stuff that you think of. And it's never good to stress the system, but you need to stress it to know where your weaknesses are. We found some weaknesses. I mean, one of the minor things that we saw yesterday was, how do we contact air traffic control when we have 8 helicopters all heading to the same scene? That's, again, one minor improvement that we're going to take forward to make sure that we have that in our plan.
Have you guys been tested this in a similar way like this, 8 patients coming in at once?
The last time that we enacted the plan for a actual casualty event and not a drill was when the bus flipped over in Marshall County on the snowy roads. I don't know if you remember that. That was approximately, I think, 2 years ago. And again, we had plenty of learning opportunities from that. Many of which learning opportunities from that were done in this plan.
Can you clarify? I think back when you said that answering to our 8 patients, we were told. I know the left one on yesterday we were told that you also received 9 patients. So so how many of those 8 patients now are critical versus non-critical?
I'll let Dr. Kerwin speak.
So we had 8 come in altogether, 1 deceased, 1 treated and released, 6 here, 3 in critical condition currently.
Okay, and the 1 deceased, that's the one that's been identified as being for
Correct.
I know you said you all have been planning and training for this, but do you think you were really truly prepared? I mean, just mentally for what happened yesterday?
I don't think anyone's ever truly prepared to get 15 gunshot wounds or a mass casualty event like that. You rehearse in your mind how you would do that. You practice those drills. The thing I say a lot about the work we do, it can be very physically demanding. It's mentally challenging. It's emotionally challenging. And then you put that on what we've been through for the last year and a half or so with COVID. It can take its toll on you. I feel like we handled it very well yesterday. But all of these things add up over time to all of the healthcare team, not just me as a surgeon, but the entire team can have that total impact there. And it's, and like I said, not only physically demanding, but mentally and emotionally as well.
Did you have to call in additional staff?
We did have additional staff come. Being in the middle of the day, there were a good number of staff already present for just our day-to-day management of the trauma center and the trauma patients. But we did have some extra staff come in.
Are you able to clarify or elaborate on the
Really can't go into those specifics for patient privacy. Who's next? Anybody? Ron.
I'm Dr. Kuput. I have the honor of being the CEO of this organization. I just want to echo everything that's been said, but most of all, when you talk about are we prepared, we have some of the finest trauma surgeons in the nation here at Regional One Health. We're open 24 hours a day for the trauma that happens within our community. And when we have to swell it as we had to do yesterday, they were ready, they were prepared, they functioned, and lives were saved. And so this has to be something that we acknowledge and we are benefit from as a community of Memphis. We don't want this tragedy to ever happen again, but we do want everyone to feel comfortable and confident that if we're faced with any type of mass casualty, Regional One Health, with the surgeons from University of Tennessee, are ready and willing and able to take care of these type of things.
I have one last question. When was the last time, being the only trauma center in the region, that the hospital sees something of this magnitude?
Well, as you know, we live in somewhat of a violent society. It's not atypical for us to have 8 patients come in with gunshot wounds at any given time, usually not all at once. So that's the difference in this situation, but it's for us to handle that many patients over a little bit longer period of time is not particularly unusual. I would like to mention one other thing. You know, we get a lot of bad press at times, Memphis does. This is one thing that we can be very proud of, is the response that happened to that tragic event yesterday. We can all be very proud of our system because it works, and it worked very well yesterday. Are there any other questions? Thank you all for coming.
All right, you have just finished watching a press conference being put on by Regional One Health. That is the healthcare system that includes places like the Regional Medical Center, the only level 1 trauma center in a 150-mile radius in our area. So a lot of those victims went to those hospitals. 8 patients were told in total that were treated across Regional One hospitals. 1 patient sadly died. 1 was treated and released. So they still have 6 patients, 3 of them in critical condition. One of the physicians saying there that 3 of them did require emergency surgery immediately after they arrived. One of the things that they all emphasized was they were able to handle it. It's not something they want to have to deal with, but they said, Dr. Peter Fisher saying, we train for these mass surge events, and you handle it. They also mentioned, of course, all the other hospital systems in the area, Baptist, Methodist, many of the others. And the immediate response of all the medical personnel that were able to immediately get the patients that had to come through by ambulance. There were a lot of people who saw helicopters, of course, in the air yesterday. Dr. Fisher said he was on one of those planes, but no patients were transported by air. They were all transported by ground. Again, we will continue this coverage throughout the day on air and online. The latest coming on News Channel 3 at noon. Just a few moments ago, you heard from hospital officials. Prior to that, Collierville police. So we're staying on top of this in every way possible. We appreciate you tuning in, and we'll be here for the latest. You have been watching special continued coverage right here on News Channel 3.